Welcome to Spotlight on St. John's. I'm your host, Brian Brown. St. John's University is a unique Catholic and Vincentian institution of higher education, and St. John's is on a mission to ensure student success. Today, I had the chance to sit down with Dr. Preety Gadhoke, Ph.D., St. John's University Associate Professor of Public Health in the College of Pharmacy and Health Sciences. Dr. Gadhoke is presently conducting research on some of the issues and impacts of the COVID-19 pandemic on people living in urban areas. Let's watch. And I will just begin by saying thank you, Dr. Preety Gadhoke from St. John's University, here today to talk about some of her research, her interests, and her own background. Welcome to the show.
Thank you, Brian. Thanks for having me and for the invitation.
So I want to get right into, you are working on some interesting research in collaboration with St. John's University and some other schools. In particular, it has to deal with COVID-19, which is a very timely subject today. Tell us about it.
Yes, sure. Thanks, Brian. So part of my inspiration to lead this study is my dedicated work on food insecurity, health disparities, and resilience in New York City's underserved communities. I also work globally across indigenous communities and in America. So COVID really began to reveal the significant social and health disparities very early, making the urgency of the study all the more pressing. So back in March 2020, I joined the COVID-19 Nutrition Response Task Force, which is led by Dr. Sheila Fleischaker at Georgetown Law. It is an enormous, a very exciting consortium of academics, scholars, researchers, advocates, and think tanks. And the impetus behind the task force is sharing and exchanging of ideas, instruments for surveys and interviews, and encouraging partnerships and collaborations in an effort to have a well-coordinated response to the urgency of the COVID-19 pandemic and its impacts on American food systems and health. The St. John's University survey is an adapted version of one developed and validated by researchers at the University of Vermont and Johns Hopkins Bloomberg School of Public Health. The researchers had at that time in April 2020 already conducted the study in Vermont. I expressed my interest and they welcomed a collaboration to run this study in New York City, in the New York City area. So in the last few weeks, it has now been expanded to include New York State, and we also have collaborators in Chicago who will be administering this adapted version. So before administering any survey, it's often necessary to adapt it to your specific population and context. Given that New York City has been more devastated by COVID-19 than any other city to date, we understood the exigence of shortening the survey for quicker responses and for asking broader questions about what we call the social determinants of health. And they include employment and job loss, access to healthcare or delay of healthcare, medical expenses, finances, as well as concerns of well-being, health conditions, whether or not they work as essential workers, and also general mental health questions. So with this collaboration, now we've added on colleagues at St. John's University and DeVille College. We're working very quickly to develop the survey and assess it for New York City.
Now, I know you're still gathering results. If you had to guess or speculate, what do you think? Because there's been a lot of research, there's been a lot of, at least publicity in the media in particular, a lot of different theories about why Queens County, why New York City was hit so hard. What do you think your survey will tell?
Yes, so social determinants of health really best explain why New York City was already vulnerable to COVID-19 and why the city was hit the hardest by the pandemic, as well as continues to suffer. So social determinants of health are the conditions in which people are born, they grow up, they learn, live, play, worship, and age. They include all the factors that I mentioned, but specifically access to affordable and available nutritious foods, economic stability, job security, quality education, safe neighborhoods, which includes the physical and built environment, and access and availability of quality health care, as well as accessible transportation and social support networks within communities. So what we've observed so far is that neighborhoods with residents who live in poverty and with more people of color, they lack access to and availability of these social determinants of health, which manifests into these forms of social and health disparities. So furthermore, not unlike any American city like Detroit or Baltimore, New York City has a dark past with inequitable and discriminatory policies that led to a separation between the haves and the have-nots, those who are white and wealthy and those who are people of color and poor. This led to very early on, back from since the 1600s, to unequal neighborhood development, investments, and resources across the city, such as unfair housing lending practices. So from my perspective, these ghosts continue to reverberate through the city's old bones, if you will.
Yeah.
Then fast forwarding to life, just before COVID-19 hit, on average, what's very disturbing is that a child born in the Upper East Side is expected to live 11 years longer than a child who's born in Brownsville, right?
Wow.
And then COVID-19 hit us, causing major disruptions and fissures in already weak systems and infrastructures that are inequitable and unequal in these neighborhoods. And now we see these social health disparities, especially for the poor and especially for those who are living in neighborhoods of people who are of color. So,
I think
yes.
COVID brought a lot of this to light, but this was happening, as you said, long before COVID-19. And I think what can we best do moving forward, or how do we fix something that's been going on for 400 plus years?
Right. So I'd say that just as we've had these disruptions and fissures in these systems for over 400 years, we've also had a lot of efforts towards having more equitable policies, more equal policies and laws and programs. So for instance, the very latest news that's very alarming about food insecurity is that up to 2 million New Yorkers may be food insecure. That's 1 in 4 households, right? Then from the school assistance programs, those poor households who really depend on the free breakfast and lunch programs, we're seeing that only about 15% may actually be accessing those benefits. So while we have those inequities, as I mentioned, we have individuals, entities, organizations, policymakers, and researchers to continue to drive strategies. So there's a lot that we could do, right? So for instance, the work that's coming out is showing that we really need to have a unified approach, number one, that is one of solidarity, that incorporates multiple disciplines, multiple sectors. We need to continue to invest in research. We need to continue to develop one unified approach, which will involve looking at anti-poverty strategies from the very top level to, specifically looking at food security and the food supply chain, for instance.
There's been a lot of talk in the media about density, and there's some theories about how close people live together as a factor, and then some others would disagree, and they would point to like Staten Island, which is a less dense population, but has still also been impacted by COVID-19. In your research and your own thoughts, is density a factor, one contributor? Is it a bigger contributor than another? Or what about density?
Yeah. So population density from an epidemiological perspective, I'm a social behavioral scientist and I apply epidemiological strategies and methods in my work, which is very interdisciplinary and collaborative. So from what we do in the work that I do is looking at the role that the environment plays in one's health, as well as personal factors and how one perceives their health, And it's really the environment in public health that drives human behavior, whether or not we choose to eat or exercise. It's the environment. If we have a healthy environment that offers parks, that offers affordable foods, that is walkable even for those who may be disabled, there is access to transportation for those who are disabled to drive them around, for instance, for easy food or meals on wheels, then we see that we can see that populations thrive. So population density is a significant factor from all perspectives in public health. Why? Because number one, from the perspective of infectious diseases, it's really that when you have population density and crowds, with what we've been discussing with social distancing, that's going to limit the ability of individuals, as much as they want to socially distance themselves, right? So thinking about crowds as you walk out your apartment complex, the crowds, the long lines outside the grocery stores that we've been seeing in New York City, for instance. So that has absolutely been a significant contribution. And there are experts in sort of urban planning and environmental areas who are talking about how to design our urban cities in a healthier way and to offer social distancing from a structural perspective first.
Okay.
St. John's University, stay close while you stand out. We offer top-ranked programs with the latest technology, scholarships, and financial aid. St. John's offers you a place to call your own. Visit stjohns.edu/standout.
End of our discussion today, but how does it work? Where do you go? What can someone do to participate in your research efforts?
So the survey is the Corona Impacts on Food Access and Healthcare Access survey is available online. It's a web-based Qualtrics survey, and it's anonymous, it's mobile friendly, which means you can complete it on your phone, you can complete it on your computer. While you're waiting in line to get food, you can complete it. It should only take about 15 minutes on average, or less. It is available on a number of sites. There's the news story that was released at St. John's University. It has a link there. I can certainly make it available on my faculty profile as well.
You have a Facebook page, correct?
There is a Facebook page as well, and that could be accessed there directly too.
Sure. And anyone can participate? Anyone in the city, just Queens, or who's your target audience?
So anyone in the greater New York City metropolitan area can participate, and that includes areas in Connecticut and New Jersey, as well as up to Westchester County and all the 5 boroughs of New York City, including Long Island.
Terrific. Is there a deadline or is there a timetable here?
Yes, I do believe that the deadline generally is about July 1st. We're already starting to look at the data. We're excited to see a very high response rate so far. We've had hundreds of individuals from St. John's community, including community partners, participate. And then we have a separate section of the survey where we are oversampling for ethnic minorities, those with a high school education, and those with a living on an income of less than $25,000 a year before taxes. So the deadline generally is just the summer by July 1st.
Terrific. Do you have a target goal of how many responses you need to get a good idea, or is there a number in mind, or how can we best get your numbers up?
Thanks. As many people as possible who are 18 years and older who can participate, the more we welcome that. So there's really no minimum number or maximum number.
Terrific. Talk a little bit about your own background, your biographical background, how you made your way not just to St. John's University, but how you got into and involved with public health and these type of issues. So tell us a little bit about your story.
Sure. So my story really begins as a first-generation immigrant to the Chicago area. So I'm definitely a city girl. I've grown up in Chicago. I've moved around America and landed here in New York City. But with my background in South Asian background as well as Indo-Caribbean background, so I really had a global perspective on health and well-being. And very early on, I had a passion for health equity, as I mentioned, really observing as a child those that have and those that do not have, and why there's a difference. Why do some people live long and why do others die prematurely? So that led me to pursue both anthropology and sociology, as well as biology in college. And there I discovered, in fact, the health belief model, which is one of the models we use in public health. It was developed by the US Public Health Service in order to understand and address how to increase participation in public health programs like vaccination programs or smoking cessation programs. And at that time, it was to prevent heart disease in the 1960s. So that's where I discovered public health, which led me to an M.P.H. in health policy and management at Emory University in Atlanta, Georgia. And from there, I really became intrigued in how public health is made from a policy perspective. Really, who are the decision makers? Who are the drivers from what we call that structural level, the really top level of influence on human behavior? So if we have public health laws that are protecting individuals, say, as we do the smoke-free ban that happened, then that encourages others to stop smoking and live a healthier life. So I was really intrigued by that. And I joined the Government Accountability Office, or GAO. GAO is known as a congressional watchdog in the legislative branch. And that's really a phenomenal place to work. I would say that is where I gained a lot of skills and knowledge in terms of program planning and evaluation and research that's really on the ground, that's real time, and that informs policymakers' needs as well as the needs of the US public.
You were in Washington.
That was in Washington, D.C., yes.
Excellent. Excellent. So you spent a lot of time in big cities between Chicago.
I did, I really did. Yes, and I remember, you know, Mr. Smith Goes to Washington was a classic film.
Sure.
I'm a big classic film buff, so that sort of desire, that patriotic desire in me took me to Washington, D.C. to really engage as a civil servant and to see how policies are made for public health.
And I, you know, with my government background, I always encourage students, you know, no matter what your major is, there are so many opportunities in and around Washington and in and around government, whether it's state government, local government, the federal government. And it's really a great experience if you can do it in your career. Parts of the country really brings you to what's often called the world's borough. You know, Queens County, tremendous diversity, and in particular, the Queens campus of St. John's University and the great student diversity that we have. Talk a little bit, I know you're involved with the Vincentian Center for Church and Society. I know you also help with the McNair program and the Ozanam Scholars Program. Talk a little bit about how you engage with students on campus at St. John's University.
Sure, I'd be happy to. As a faculty research fellow with the Vincentian Center for Church and Society, as you mentioned, my research on health inequities was supported along with some really wonderful opportunities to create collaborations across campus with faculty, pressing on really social justice issues. And that includes St. John's College of Liberal Arts and Sciences, as well as my very own college, and Tobin School of Business. So that is one way I find that St. John's community and the St. John's campus is very open. We call ourselves the St. John's family, and it truly is very much that way. And I felt very welcomed and embraced across campus to be able to really, spread my arms out and make connections. Then secondly, I'm a faculty advisor and mentor for the Ozanam Scholars Program. I've been able to really share my public health expertise with students for their social justice capstone research projects. And these are undergraduate students, scholars. So I've worked side by side with cohorts of Ozanam scholars guiding their research on sustainable development, and had an opportunity to work with indigenous Shuar communities in the Ecuadorian Amazon for 3 years. And that was fantastic. Each cohort is about 16 to 21 students. Those were wonderful opportunities for mentorship, for student engagement, and community engagement all at once. And then finally, as a faculty mentor for the McNair Scholars Program, I've also been able to work with students from underrepresented populations and underserved communities to really develop their research skills and prepare them for postgraduate professional training and success. Last but not least, our M.P.H students themselves are diverse. They come from diverse backgrounds, underserved communities as well, from not only New York City and Queens, but all the way around the world and in the Caribbean, from India and China and Japan. And so I've really had a tremendous opportunity every year to work with students on their capstone projects on public health programs.
Now, if you can speak about outcomes a little bit, these students who you've worked with, like, can you track where they are now, or what do they do upon graduation? Are they still involved in this sort of research, or does it springboard to something different?
Yes, we're very proud of our students and our graduates. Many of them have stayed in the track of public health. In fact, all of them have. Some of them have had interests as pre-med, and they went into medical school. Others have recently got promotions as project managers or project coordinators of large randomized controlled trials. One recent one who actually had a capstone project at India Home in Queens itself, was hired by India Home. And so they're really wonderful examples of students from the first cohort to the last, who we just graduated, who've been hired immediately after by the agency or a community-based organization with whom they worked for their capstone project. So we're very proud of our track record, which is very solid.
And you've laid out a lot of areas that really need to be addressed, not just in the short term, but in the long term as well. As our time comes to an end, I want to ask you, if you can, for all our viewers and for potential students, make the case for St. John's University, in particular, make the case for studying public health or the sciences at St. John's.
I'd love to. St. John's University offers a unique social justice and human rights approach to education and community service because of our Vincentian, metropolitan, and global approach to education, which is really quite unique. We started out as a commuter university. We continue to really emphasize flexibility in our programs, such as the M.P.H. It's an evening program. You can work in the day from 8 to 5, 9 to 5, and join us in the evenings and pursue higher education. And then really it's, helping to support yourself and your households. Also, last but not least, we really have a very personalized approach to education because of our faculty-student ratios. So I think altogether, this is the place to come to St. John's University.
I always like to try to include a little bit of a lightning round if I can. So we'll go to some quick, short answers, and they'll all be focused on Queens in particular. Aside from the Queens campus of St. John's, what's your favorite spot in Queens County?
That would be, wow, that's a good question. Favorite spot? Oh, of course. It's Fort Totten Park, where I live in Bayside. I always go there for walks and to just hang out and look at the water and look at the books.
Nice view. That's a nice view over there. Best place to eat, Queens County. Favorite restaurant, your choice spot.
Favorite place to eat would be, there's a really cute ramen shop in Astoria that I go to. It's fantastic.
Lots of good eating in Astoria. All right, last one, Queens County. Make the case for an outsider, not a native New Yorker, why they should come, or at least to visit. If you're not going to go to school in St. John's, at least why you should come visit Queens County.
Queens County is hands down the most diverse and thriving and dynamic place in the world. So if you are interested in cuisine, as you're asking me, as culture, in nature, and a hustling, bustling county, it's the place to come.
Well said. I couldn't agree with you any more. I want to thank you, Dr. Preety Gadhoke. We are going to share her research survey and information so our viewers can click on the link and participate in the survey. Really important issue, not just in Queens County, but in New York City and beyond. And there's a lot of good work going on by Dr. Gadhoke, by the other people involved in the research, and at St. John's University. So again, I want to thank you for your time. Keep up the great work, and hope to see you in person on campus very, very soon. Thank you.
Thank you very much, Brian. I really appreciate this. Have a great day.
Thank you.
Take care.
Next step in your education may be closer than you think at St. John's University, a Catholic and Vincentian university with a proud 150-year history. St. John's has 3 campuses in New York, so you can stay close while you stand out. We offer top-ranked academic programs, state-of-the-art facilities, financial aid, and scholarships. Above all, St. John's offers you a place to call your own. Visit stjohns.edu/standout to learn more and apply now.